What are the effects of cigarettes on the human body? Cigarettes are harmful to our health. That is not exactly breaking news. We have known for decades about the dangers of smoking. But, specifically, how do cigarettes harm us? Let us take a look at what happens when their ingredients are used, as they pass through our bodies, and the physical benefits that come with quitting smoking. Each time you take a breath in, smoke contains over 5,000 chemical compounds into contact with the tissues of the body. Tar, a black, resinous substance, has been used since the beginning. Starts to coat teeth and gums. Tooth enamel is harmed, which leads to decay. Smoke also damages nerve endings in the nose over time, resulting in a loss of smell inside the lungs and airways. Infections are more likely when you smoke. Chronic disorders such as bronchitis and emphysema are also common. It accomplishes this by causing damage to the cilia. The goal of these microscopic hair-like structures is to keep the airways clear. The alveoli are then filled with it, tiny air sacs that allow oxygen and carbon dioxide to be exchanged between the blood and the lungs. Carbon monoxide, a poisonous gas, passes through the membrane and into the bloodstream. Hemoglobin binding, as well as displacing oxygen. Normally, it would have moved around the body. One of the reasons why smoking can cause oxygen deprivation is because of this, and a feeling of being out of breath. In less than 10 seconds, nicotine, a stimulant, is carried by the bloodstream to the brain, causing dopamine and other chemicals to be released. Endorphins, for example. Smoking is very addicting due to the positive sensations it produces. Nicotine and other compounds in cigarettes are harmful to your health, produce blood vessel constriction at the same time, and cause harm to their endothelium lining, limiting the flow of blood. These vascular actions cause blood vessel walls to harden and increase the stickiness of blood platelets, increasing the likelihood of clot formation, and are known to cause heart attacks and strokes. Many of the chemicals found in cigarettes have the potential to cause harmful mutations. Cancers are caused by mutations in the body's DNA. Ingredients such as arsenic and nickel are also present, may cause DNA repair to be disrupted. As a result, the body's ability to fight many cancers is jeopardized. In fact, cancer is responsible for 1 out of every 3 deaths in the United States is brought on by smoking. It is not just lung cancer either. Smoking has been linked to cancer in a variety of tissues and organs, as well as deteriorated vision, as well as weakened bones. It makes it more difficult for women to conceive. It can also cause erectile dysfunction in men. However, for those who have given up smoking, there is a lot to like here. Physically, there are almost immediate and long-term benefits. After only 20 minutes, a smoker's last cigarette is extinguished. Their blood pressure and heart rate begin to return to normal. Carbon monoxide levels stabilize after 12 hours, increasing the oxygen carrying capacity of the blood. After a day of abstaining, as blood pressure and heart rates return to normal, the risk of a heart attack decreases. 2 days later, the nerve endings that control smell and taste begin to regenerate. After about a month, the lungs become healthier. Coughing and shortness of breath are reduced. The airways and lungs have delicate hair-like cilia. Within weeks, you should be able to resume your normal routine. After 9 months, they are restored, increasing infection resistance. By the 1-year mark after quitting, as blood vessel function improves, the risk of heart disease falls by half. After 5 years, the likelihood of a clot developing decreases considerably. Moreover, the risk of stroke is decreasing. The chances of developing fatal lung cancer after 10 years are slim, slashed by a half dozen%. Because the body's ability to repair DNA has been restored, this is most likely the case. After 15 years, the chances of developing coronary heart disease have increased. Is almost identical to that of a non-smoker. It is pointless to pretend that this is all simple. Anxiety and depression are common side effects of quitting as a result of nicotine withdrawal. However, such side effects are usually only temporary. And, thanks to a growing array of technologies, quitting is becoming easier. Gum replacement therapy is a method of replacing nicotine in the body. Patches of skin, lozenges, as well as sprays, may aid in the cessation of cigarette smoking. They function by triggering the brain's nicotine receptors. As a result, withdrawal symptoms are avoided, without the use of any other potentially dangerous ingredients. Counseling and support groups are available. CBT stands for Cognitive Behavioral Therapy, as well as moderately intense exercise. Additionally, it can assist smokers in remaining cigarette-free. That is fantastic news, because quitting puts you and your body on the road to recovery.